Hi, I'm Steve Rowe, Executive Director. Today is Wednesday, February 16th. I'm recording at about 2:30 in the afternoon, and we intentionally are recording on Wednesday today because we wanted to have as current information as possible before we uploaded this video for you. Today is a staff testing day, and I'm happy to say that at least as of about 2:20, 10 minutes ago, we had no new positive cases of COVID with our employees. We had tested residents in the health center and assisted living on Monday this week and had no new positive cases. And this follows last week where we had no new resident cases and no new employee cases. So assuming that we continue to have no cases through the rest of the afternoon as we test evening shift employees who are just coming to work in the next few minutes, our hope is that we can start to resume some normal in-person programs and in-person dining next week. So it's like, unless things really blow up in the next hour and a half or so, that is our plan. And the first in-person program that we will plan for would be a week from today, next Wednesday, February 23rd. And it will be a rescheduled program with the resident semi-annual remembrance program and semi-annual meeting. So please be looking forward to that. Information about it will be in the weekly memo tomorrow, unless something blows up in the next 90 minutes or so as we complete the staff testing today. We're also looking forward to resuming in-person dining, and we're kind of gearing up to do that late next week. Bruce and his dining services team are working on a couple of special events for us. One at East and one at the main campus to kind of kick off in-person dining, and we will prepare announcements for that, and those should be in your mailboxes by the end of this week, announcing what's coming for the end of next week with in-person dining. So hopefully, again, if we can just hold on for another 90 minutes or so and get through all the staff testing, we will get back to at least one more step towards normalcy. The situation, as always, is fluid. So just to let you know that it's like, it is certainly our intention to start in-person program and in-person dining next week. If something happens between now and when we do it, we might need to pull the plug, but we also need to plan for moving forward. So that's the announcements that you'll see here shortly. Many of you are aware that the governor's public health emergency proclamation ended yesterday, and that has certainly caused some confusion for people here and around our community. One of the causes of confusion is related to masks, and we want to let you know that Oak Knoll, as Kim and I are looking at, at current information, we are following CDC guidance, and the CDC guidance is still to wear masks indoors. So we would still encourage you to, when you leave your apartment, to put a mask on. We will certainly expect that when we resume in-person programs, that people have masks on. And really the only place in the common area spaces within Oak Knoll that you wouldn't have a mask on is when you're eating in a restaurant. So please continue to respect the mask recommendations. And many of your neighbors are still anxious about that, and we would just encourage you to be respectful of everyone and keep wearing a mask until the CDC says that's no longer necessary. Another change with the expiration of the public health emergency is that the state is no longer supporting and providing the information that they had related to case counts and positivity rates and things like that in the same way. So there's been a website that we have referred to for most of the last 2 years that has really informed our decisions for what we are doing here at Oak Knoll. The data is no longer being updated. It was updated last Wednesday for the final time. So we are looking at new sources of information, and it's kind of the same but kind of different. So what we have been focused on is actually 14-day moving case counts, so looking at the total daily case count over the most recent 14 days. That information is not available really. What is available to us is from the Iowa Department of Public Health. They're looking at 7-day information. So I looked at that earlier this afternoon. In Johnson County for the past 7 days, there have been 318 new cases of COVID, which, as you think about that on an average daily basis, would be about 45 new cases per day. So certainly trending in the right direction. A month ago at this time, we were at 450 cases per day. So we're a tenth of that, but still 45 new cases per day is not insignificant. So COVID is not over, much as some people would like you to believe. We will still continue to have our precautions and try to keep everybody as safe as we possibly can. I think that's about all that I need to talk about COVID actually today. One last thing, we will be doing a booster clinic for anybody who would like to get a booster dose of vaccine, and that is next Wednesday at 10 a.m. Sarah Ruhlman is our director of nursing, and Sarah is basically taking reservations for that booster clinic. So if you are somebody who has not had an opportunity to get a booster shot yet and you would like one, which we would certainly recommend, please call Sarah Ruhlman. Her extension is 5259, or if you're calling from an outside phone, it is 319-887-5259. And again, Sarah Ruhlman is the person who's coordinating that booster clinic for us. Kind of short message today, but very positive news, and we will hope to follow this up next week with even better news. If we can make it through today and not have any new cases, that will actually allow us to stop doing resident testing, and we wouldn't need to be doing the employee testing either for some period of time at least, and we're all looking forward to that. Hope you're doing well. Let us know if you have any questions, and we will see you again in a couple of weeks. Take care.